Heart disease is not the number one cause of death in the United States. You've been misled. Hello everyone, I'm lifestyle medicine cardiologist Dr. Stephen Lohman. In this video, we're going to examine what the true number one cause of death in America is. You see, we've been led to believe by the Centers for Disease Control that heart disease has been the number one cause of death in America for more than 100 years in a row, towering over all other causes of death. Well, we have to ask ourselves the question, what's the actual cause of heart disease? And if we really examine that, we find out heart disease is a diet and lifestyle related disorder, right? So there is a study called the Global Burden of Disease Study, which looks in the whole entire population of the planet Earth to figure out what types of factors could be modified to prevent premature death and premature disability. And what is it? Actually, dietary risk is the number one factor that we can affect and change to improve long-term death and disability in the whole world, and certainly in the United States as well. And this makes a lot of sense. When you look at the data, it's very clear that heart disease is predominantly preventable, maybe even 98, 99% preventable through diet and lifestyle changes. And even after somebody has heart disease, a vast majority is reversible through strict diet and lifestyle related changes. So if heart disease is caused by diet and lifestyle, then the true number one cause of death in America is the American diet, which we know is very, very sad, literally. So why is it that we say it in a different way? Why do we say heart disease is the number one cause of death? We really, truly need to be saying it the way it is, because if we want to change our system more towards a lifestyle medicine model to treat the cause of somebody's illness, diet and lifestyle, we need to start being truthful with everybody and saying it as it is, instead of completely just wording it in a way in which makes us feel better about what truly is the major issues with our current healthcare crisis in America and our current state of health. So I think that we should say the number one cause of death in America is the American diet, and maybe you could tag on other lifestyle factors as well. So considering the number one cause of death in America is diet and lifestyle related factors, you would think that the number one thing your doctor talks to you about during a medical visit is diet and lifestyle related factors, right? You would think that's the number one thing that medical professionals are trained to do in their medical training in medical school and such, right? No, not at all. There is a huge disconnect between what the science shows that we can do in regards to lifestyle medicine, preventing and reversing all these chronic diseases, saving millions of lives, literally, and the actual practice of medicine day to day when you see your doctor. You see, when you see your doctor, you get this short visit. All they have the time to do is just ask you a bunch of questions, take a listen to you, and figure out which pills to prescribe you and which tests to order, right? They don't have time to sit there and talk about your breakfast, your lunch, and your dinner, your exercise, and not only just educating patients about lifestyle, but motivating them and inspiring them to actually make the lifestyle changes. It's a huge disconnect. And when you really think about it, you go back to the 1940s and the 1950s. There's a great analogy as to what's going on today with lifestyle compared to what happened a long time ago with tobacco. All doctors smoked, all people smoked. The average person smoked about a half a pack of cigarettes per day. You went everywhere, you went to medical conferences, it was a haze of smoke, right? Everybody smoked, and doctors even recommended it. There was tons of research showing smoking was not bad for you at all and may actually be good for you in many cases. And so why would a doctor, when the science is finally coming out saying, look, smoking's not good for you, doctors are going to be resistant to telling their patients to stop smoking because they themselves smoked, and they probably didn't read the research on smoking cigarettes and the harm of tobacco. And not only that, there was a lot of confusing research funded by the tobacco industry to actually say smoking was good for you. So Surgeon General puts a warning on cigarettes 1964, smoking may cause cancer. The next week, your American Medical Association says we disagree with the Surgeon General. Extensive research shows smoking in moderation is okay. That's your own American Medical Association statement. Now we fast forward to today, and let's look at how food is almost exactly the same as what tobacco used to be in the 1940s, 50s, and the early 1960s. You go to a medical conference, and what do you get? Pizza, potato chips, crackers, desserts, and soda pop, right? All doctors, for the most part, don't follow a healthy diet and lifestyle. So why would they recommend it to their patients? Doctors aren't trained in nutrition. Most doctors don't read nutrition-related research, so therefore they're not going to discuss it with their patients. In the 1940s and 50s, doctors didn't get paid to help their patients stop smoking. And today, doctors don't get paid to talk to their patients about nutrition. Actually, they will get paid less. It takes a lot of time, and they would actually see fewer patients if they were able to motivate and inspire their patients to get healthy, lose weight, not be diabetic, not have heart attacks, not need stents. They wouldn't have as many patients, right? Our current system is not aligned to be reimbursing doctors for nutrition and lifestyle-related counseling. It's just not. And so this is why we have such a disconnect. I think of a story of a patient that I had a few years ago that showed me the cut on their arm, where they said, look, this is where the doctor at Cleveland Clinic cut in and did one of the first angiograms ever. I was the patient. I'm looking at that saying, wow, I've never seen a scar like that. That's amazing. And then they said, you know what? Just past that is the burn wound from where the cardiologist dropped the cigarette on me and burned me during the procedure. Doctors used to smoke during procedures in the hospital. That's just the way it was. Nowadays, doctors just eat unhealthy diets, and most healthcare professionals do, so they're not recommending it to their patients. We need to be the change. The number one cause of death amongst cardiologists is heart disease. The president of the American Heart Association had a heart attack at the podium at the American Heart Association meeting. They always say you need to put the oxygen mask on yourself first before you could help others, right? Well, that holds true for the healthcare profession. We as physicians need to take care of our own health. We need to learn evidence-based nutrition. We need to practice good lifestyle habits. Be a normal weight. Don't smoke cigarettes so that we can be knowledgeable and help our patients achieve those same things as well. We need to change the system away from pills and towards plants, away from the pharmacy and to the pharmacy. Let's be the change. Let's speak up, and we can do it. So I hope you liked this video. If you did, please subscribe to my channel and turn the notifications on. Check out my social media links down and below and leave me a comment. Let me know, why do you think that our system is disconnected away from lifestyle medicine, and what do you think the solution is to our major healthcare crisis in this regards? See you next time.